Now to this evening's interview, Governor Greg Abbott joining us live. Governor, thanks so much for your time. As of noon today, your new order has closed bars and limited restaurant capacity.
Do you feel that you acted too quickly in reopening Texas, although we know people were so eager to get back to work to support their families?
You know, if you look to the reopening, to the best day we had it in the state of Texas until we get today, you see something very interesting. So about a month after I announced the reopening, on this I announced it on April the 27th. On this day in May, get these numbers. We had 589 people test positive. Today, that number has increased by tenfold to more than 5,700. We have 1,540 people in hospitals on this day last month. Now it's more than 5,100. On this day last month, we had the lowest positivity rate on record after we slowed the spread of the coronavirus. Today, we're over 11%. What I said from the very beginning as we opened up is that if the numbers worsened, which they did more than a month after we opened up, then Texas would take action. And that's exactly why I took the action I did today, because we took action that we know will slow the spread based upon data that we have.
All right, Governor, the Harris County judge was direct with what she was asking today. She issued a stay-at-home advisory.
It's not an order because you've not given local leaders that ability to have that authority. Would you consider giving them the authority now?
First, I will tell you this, and that is I've been saying the same thing this week. Now, the safest place a person can be is at home. When you look at the amount of spread that we're seeing in some places, like in Harris County, if a person doesn't need to be out, if they're not going to work or going shopping like they need to do, whatever the case may be, they should stay at home. And if they do need to get out, the best practice is for them to wear a mask and maintain their distance from others. That said, now is not the time for stay-at-home policies across the entire board. I believe we can do both, continue to engage in our economy while slowing the spread. Remember, we did that for months. Texans knew how to slow the spread by doing what we did in March and April and during the course of May. All we need to do is get back to those best practices of wearing a mask, sanitizing your hands, keeping your distance, and, if possible, and especially if you're over the age of 65, stay home.
Governor, as you know, faith very important in the state of Texas, but churches have been a source of COVID spread.
Well, this becomes a First Amendment concern. Do you plan to reinstate any restrictions on houses of worship?
So I believe that we can both protect constitutional rights while also containing the spread of the coronavirus. Under my new order issued today, churches do remain open. However, there are guidelines in place for these churches that instill distancing practices. All the churches that I've spoken with, or the church leaders I've spoken with, they're using these safe distancing practices because they don't want the members of their church to contract COVID-19. They don't want to lose the lives of any of the members of their churches. And so I believe the churches will act responsibly and make sure that they practice distancing so as to slow the spread of the coronavirus.
Also, Governor, I know just moments ago your office announced that the federal government will keep financially supporting COVID testing sites across Texas, 4 of which are in our area.
And now when it comes to hospitals, what would be your plan to bolster healthcare systems that are experiencing that surge capacity?
So let me address both of those. First, with regard to the testing, so I talked to the vice president last night. My team has been working with the officials with Health and Human Services to make sure that we will have these testing sites still open to make sure that we will be able to conduct robust testing across the Harris County region. With regard to the hospitals and healthcare capacity, know this, and that is the entirety of this week, I've been talking to administrators and doctors and leaders of many of the hospitals in Harris County, as well as in other counties, working on strategies to make sure that everybody who needs access to a hospital bed who tests positive for COVID-19 is going to have one, but also working on strategies to ensure that all of the other health care needs of everybody else who may not have COVID-19 will also be addressed.
You know, Governor, there are some hospitals here in Harris County that are not canceling elective procedures despite your order.
Is that allowed even if those hospitals have enough capacity for ICU patients or maybe don't even have ICU patients?
So if you read the wording of my executive order, it does allow some hospitals to conduct some procedures that ensure that those procedures will be able to be allowed. However, they must make a bed available if a patient shows up with COVID-19.
All right. August is right around the corner, and I know you, along with state education leaders, have said that students will be able to go back to the campuses. But
considering our current situation, under what circumstances would campuses actually stay closed this fall?
So the Texas Education Agency is prepared for any contingency. There's two key phrases the Education Commissioner is focused on. First and foremost is protecting the health and safety of all students, teachers, staff, as well as parents. And second is maintaining a level of flexibility in order to achieve that health and safety. What that means is this. The goal is to have students in classrooms with teachers and fellow students because that is the best setting for them. If, however, there is an outbreak of COVID-19, whether it be community-wide or in a particular school, they do have the flexibility to provide enhanced online distance learning for their students. They were thrust into that situation back in March of this past school year. They now have much improved strategies and practices to make sure distance learning will be far more advanced, far more effective. We cannot lose a generation of students to this pandemic. So we must use these smart strategies to make sure that students will be educated, but be done so in a way that reduces and controls the spread of COVID-19.
Governor, as you know, the state's positivity rate has been above 10% since this past Wednesday. In the city of Houston, it's actually 11%.
And I know you told us last month anything above 10% was concerning. Are you considering any additional measures right now?
So it's because the positivity rate went above 10%. That was one of the things that spurred me into action because, as you pointed out, I announced a long time ago that if the positivity rate did go above 10%, it would lead to action on my part, and that's exactly what we delivered today. So statewide, the positivity rate now is 11.76%, and that's exactly why we are taking actions that data has shown should reduce the spread, such as closing bars, which happen to be a location where we've got reports from across the entire state of Texas that COVID-19 was spreading from those types of locations.
All right, finally, this evening, Governor, your advice to Houstonians going forward here in the next few weeks.
Please understand this, and that is your health is the most important thing. You can ensure the safety of your health by staying home if at all possible. If you do need to get out, please wear a mask, sanitize your hands, and keep your distance from others. Those very same practices that led to the spread of the coronavirus in the first place.
All right, Governor Greg Abbott, thank you so much. We appreciate your time as always.
Thank you all.